developing contour, color, and contact with G-aenial universal flow. Preoperative occlusal view of defective amalgam restoration on the maxillary left second molar with recurrent decay. Radiographic evaluation confirms the diagnosis of interproximal recurrent caries. After placing the dental dam using the modified dam technique, the pre-existing amalgam restoration was removed with a number 6813 amalgam removal burr by Brasseler. The dam was removed and a shade selection was performed using the clear 2-layer shade tab by Heraeus Kulzer with a combination of A3 and C3 shaded nanohybrid flowable composite resin G-aenial universal flow by GC. The carious dentin was removed using a 30 micron DET6 tapered diamond burr. Although an amalgam replacement preparation, the adhesive preparation design is to only include carious enamel, provide access to the carious dentin, and remove any residual amalgam staining. The preparation of the maxillary left first premolar was disinfected with a 2% chlorhexidine, Conceptus by Ultradent. A selective enamel etch procedure was performed. The prepared and the unprepared enamel was etched with a 37.5% phosphoric acid gel etchant by Kerr for 15 seconds and rinsed for 5 seconds. A self-etch adhesive G-aenial bond by GC was placed on the enamel and dentin surfaces with an applicator tip for 10 seconds. The adhesive was air dried for 5 seconds using an ADEC warm air tooth dryer and light cured for 10 seconds. A contoured sectional matrix band was placed in the interproximal area. A wedge was placed for seal, contour, and tooth separation, and the band was burnished against the adjacent tooth to the desired contact area. A C3 shaded flowable composite material, G-aenial universal flow by GC, was injected into the proximal region of the preparation. This elastic material acts as a stress breaker, reducing the effect of polymerization shrinkage while reducing the potential for gap formation. Pain indicates that placement of flowable into the proximal box may contribute to a reduction in microleakage at the cavo surface margin when compared to the placement of an injectable glass ionomer. Notice I use a ball-tipped instrument, an M1 by American Eagle, to adapt and distribute the flowable material, and light cure for 10 seconds using our ramp mode. Uno and Asmussen suggest that using a slower polymerization causes an improved flow of molecules in the material, while decreasing the polymerization shrinkage stress in the restoration. I use an incremental layering of G-aenial universal flow to improve the marginal integration. Reports by Yamazaki, Chi, and Felix indicate that the use of an incremental layering technique resulted in significantly less microleakage compared to the use of a bulk technique, which indicates this layering technique with these next generation flowables is effective in improving marginal sealing at the interface. Notice the excellent internal adaptation of this flowable material along the cavity walls. I use a successive build-up technique. The first increment of C3 shaded flowable is applied to a single dentin surface without contacting the opposing walls, and I develop each cusp separately, developing lobes, the oblique ridge, the marginal ridge, and the occlusal planes. By placing a series of composite increments, I minimize the C-factor within the cavity preparation. By strategically placing successive layers of flowable composite material, you can minimize the development of stress at the tooth resin interface. Proper finishing and polishing reduces wear and better simulates the appearance of enamel. The occlusal contours and the restorative interface is refined with a 30-fluted tapered H274 finishing burr by Brasseler. Notice this pyramidal shape perfectly follows the occlusal anatomical contours. A silicone impregnated brush, a Composite Pro by Brasseler, is used to enhance the smoothness. An enhanced foam cup with a loose abrasive diamond polishing paste is used to create a high luster. The proximal surface is inspected with unwaxed dental floss to verify adequate contact and the absence of gingival overhangs. In addition, the postoperative radiographic review reveals no residual resin tags and an optimal integration of biomaterial at the interface. Notice the radiopacity is similar to enamel, which makes it easy to identify an open interface and/or recurrent caries. The postoperative result achieved with this flowable composite, G-aenial universal flow, demonstrates the ease of developing proximal contact and marginal integrity while integrating color with form and function.